Good morning, good morning. We'll go ahead at 8:31, call the meeting to order. Could we have a roll call from our city clerk?
The record shall reflect that the chair and vice chair are present.
To speak on an item on the agenda, please fill out a speaker slip with the number you wish to speak on. For members of the public that are participating via Zoom, you may raise your hand to indicate you would like to speak. We will go ahead and approve our minutes. I apologize, I wasn't able to attend the last meeting. So I'll go ahead and leave it to the mayor to recognize those minutes. So approved. Do we have any oral communications? Okay. And if I could ask for everyone to stand for the Pledge of Allegiance. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And let's go ahead and jump right into item D1, our Regional Housing Assistance Program overview. Thank you, Jonathan.
Thank you, Madam Chair. Discussion item 1 provides an overview from Deanna Beck, Director at the County of San Diego for Health and Human Agencies, to provide an overview of the RHAP program and the utilization of a Vista Motel.
Have to turn it on. Hi, good morning, Mayor and council members. My name's Deanna Beck. I'm with the County of San Diego. I'm the director of the Office of Homeless Solutions for the county, and I'm happy to be here to talk about our program. Apologize for being late. I made a journey from Chula Vista this morning, which in the rain is not fun. So thanks for having me. So our Regional Homeless Assistance Program, or RHAP for short, was stood up by the county in 2020. So it's been around for about 5 years. And it was stood up in response to a growing population of homeless individuals in unincorporated communities. So all the way from Spring Valley to East County, Lakeside, Riverbed, all the way up to Fallbrook. So when county was looking at the program to shelter people, we faced a lot of, a geographical challenge. So one, for example, a singular site like a brick and mortar shelter didn't really make sense because we had folks, in a 100-mile span and with different unique needs and ties to those communities in particular. So we looked at different programs across, did some research, and found that a scattered site sheltering program would probably be best for our geography and our unincorporated communities. So this program is an emergency shelter program that leverages hotels and motels to shelter folks and then provides wraparound services to those that participate in a program. So the program has gone through some changes throughout the years. Initially was not consistently serving folks. So initially when it was stood up, we were looking at particular encampments, like large encampments, for example, in Spring Valley or the riverbed. So we would go out, clear out the encampment, offer services to folks, and then shelter them. But it wasn't, we didn't have a consistent outreach team. We didn't have a consistent provision of these services early on in the program. So when Office of Homeless Solutions was stood up in 2021, we launched in July of 2021, we at that point formed the county outreach team for the unincorporated communities, so all the way coverage from south to north. We partner with Sheriff's Department, so they have a what they call a heart team that's dedicated to homeless outreach. And then we partner with our other county departments, like Department of Public Works for cleanup, and Department of Parks and Recreation, and some of the other internal departments that form the comprehensive county outreach team. For the Regional Homeless Assistance Program, that's our primary sheltering program. We contract with an entity named Equus, and they've been our contractor since the beginning. It's gone again through a lot of improvements, a lot of amendments, a lot of lessons learned over the time, but essentially we feel like we're in a very good spot with the way the program works. So currently, it does provide shelter for up to 250 households on any given night. So that can be up to about 400 folks that comprise those households. So we are, in addition to just sheltering folks, of course, our contractor provides comprehensive services to connect them to anything based on their unique set of needs, and then ultimately connect them to permanent housing. We're seeing consistently in this program for the last 5 years, we've seen good success of people exiting to permanent housing, and currently it's about 40% of households that do exit to permanent housing. Now that is, it may not seem like, 40%, it's not a lot, but compared to other programs here locally, statewide, or nationwide, it is a higher percentage and a better success rate. The hotels, they partner with our contractor, and so the hotels also have a responsibility when it comes to this program. They sign an agreement with our contractor. They agree to monitor and not allow any activity, like, for example, illegal activity, loitering, different things like that around the hotel. They report to the program managers and work closely with the contractor to monitor that type of activity. Now, has it happened? Yes. And what do we do about it? We as soon as that's reported, of course, we're looped in, the contractor's looped in, and we try to mitigate it as quickly as possible, as we clearly don't want those types of activities happening. Folks are, if they violate the rules, there's a strict set of rules that the program participants sign as well. They agree to work with the case manager. They all have to have work on their housing plan, get into services. They meet with the case manager at least once weekly, if not more, and then work on the housing plan to permanent housing. Hotels are across the region. We've used different hotels over time in different communities. We do have a challenge of not having hotels in unincorporated communities. There's not a great deal of hotels. We try to use ones that we do have, like, for example, in Fallbrook or some of the other communities, but we are challenged with that. So sometimes there are hotels that are in the cities, like City of San Diego, and we've used hotels in the City of Vista as well. The reason for the location of hotels is the proximity to the unincorporated communities. So folks generally from those communities are accessing services, and they have family in the region and other lifelines that are really crucial to their success. So the more we can connect them to those supports and continue those supports, the more successful they can be. So since the inception, the program has served over 2,600 individuals. It continues to, current capacity, as I mentioned, continues to be up to 250 households on any given night. We are currently in the process of contract reprocurement, and currently it's still under the old contract, but we're hoping to have the new contract in place by next month. In addition to RHAP, we have other options for our folks from the unincorporated. We have now, as of tomorrow, we'll have 3 safe parking sites, one in El Cajon, one in Spring Valley, and then we just launched one in Grantville. And then we're also working on a single site, sleeping cabin site, which is down in south in the city of Lemon Grove, but that one is still a little farther away. So we hope to add other opportunities for folks and not just have one singular option, because one size just doesn't fit all. So that's kind of a broad overview. I'm happy to answer any questions.
Yes, thank you so much. I did have one question. If you could clarify, what was the start of this program?
It was January of 2020.
Okay. And it sounds like you're using a variety of sites for hotels.
That's correct.
One of the items that we're working on is to find a location for the next phase of our navigation center. So I'm, trying to purposefully map what is the current shelter arrangement in our region, right? And it sounds like you don't just use one site, you're using multiple. So would you be using hotels currently in Vista at this time? You don't necessarily need to name them, but would there be nearby sites that people could access your services?
So over the years, we have used hotels in Vista, and we had about a pause last year, so we weren't using hotel here. But in April, at the end of April of this year, we started using a hotel in Vista. So we're currently using one, and there's about 20, on average, about 22 to 24 households in that hotel. So that's the one that we're currently using here locally.
Okay, and I'd love to learn more about the single cabin sites, especially as it's, tested and onboarded in that other city. So I appreciate that information.
Yes, we're eager to get that site going. It has been facing some challenges, but it's still moving forward. So so we hope to. We're looking at about 60 cabin site with all the services like on site for case management, and so it's a different kind of intervention, where folks are more in that community, that milieu.
Is that meant to be a longer term program, or is it similar standard 30, 60 days like most of our shelters?
We're looking at an average stay at that hotel, kind of projecting it at about 6 months. We're looking at, most likely will serve more chronically homeless folks that might need more intervention, more
little bit more
services,
transitional.
more stabilization. Yeah. So we are looking at about an average stay of 6 months in the cabins.
Well, thank you, and thank you for coming. Mayor, did you have additional questions?
Yeah, I appreciate you making the trip up, and thank you for having this dialogue with us. I really do want to ask the county, when you utilize resources in our city, on behalf of all of the mayors across the county, I want you, I really feel, especially with all that we've done in Vista, which is more than any other city in this county, and you see all these people sitting behind you that are all in the service of the city of Vista, we want better information sharing. I introduced you to Carla, remember? Nothing happened with Carla. She was out there for 3 weeks after you and I met, and I had the sheriff's department take her on 5150, and wherever she went, I never got the information because it's HIPAA protected. She was gone for about 3 weeks on a 5150 hold. She doesn't know who she is. She doesn't, she thinks her kids are coming to get her, and she thinks Fresno's 20 minutes from here, and she thinks that's where her kids are. And she's back today in a wheelchair in the same place. And I don't know if Carla was part of the Equus program or not, but what I do know is Carla wasn't there before the Equus program came to that hotel. And, we know that when people walk off from your program, they might become homeless in our city. So we want the respect of full information sharing with our professionals. These are professional people who've given their life to helping people. And I am not going to tolerate any longer anybody who comes to me and says they're not going to share information. We're all trying to work together to solve this problem. The siloing and I don't know what the motivations are, but I'm going to attack all the motivations for refusing to share information as some kind of jealous nonsense. We need to all work together, and that means sharing the information. I don't need the information, but my professionals here need it. We need to know, we need to be able to follow along. If If the people are in our city boundaries, then we need to have full awareness of what's going on. They're winding up on our streets. So we need to be working hand in hand. And this is what I want, is I want a cooperative relationship, not an adversarial relationship. And so I apologize to be combative about that, but I understand that we still don't have full information sharing. It's been limited, and I don't like that. And somebody needs to be confrontational and say it just like I'm saying it, that it's not okay. And I want to know what's going on with Carla. I want to know why Carla's still out there. What I want the county of San Diego to do is do its job on mental health and not leave Carla to die out there. I'm really upset about this, very personally upset. The situation around this hotel, we fought so hard, as I told you in private, we fought so hard to clean up the encampments in this area, and we did a great job. Our sheriff's deputies and our outreach workers, we really made a strategic effort here, and we pretty much eliminated all the encampment activity. And I can't for sure say that it's Equus. What I can for sure say is that the timing of the reoccurrence of the people living in the drainage ditch and all of the encampment activity reappeared literally identically in time with the Equus program. So it might not be causal, but it's definitely correlated. There's definitely smoke. I don't know if there's fire, but when you bring this encampment activity to our city, you're not our partner, you're not our friend, you're doing something to us. Unfortunately, there are individuals who've been exited from the program. There are other individuals in the program who are choosing to loiter on the landscaping right next to the road. And they seem to be loitering with individuals who are not part of the program. My guess is it's to consume drugs with them, to sell or buy drugs with them. I asked those people to hang out in the hotel pool area. They have seating. They could go and have a seat if they're part of the program. I think the issue is they're not allowing the people that are not part of the program. So there has to be some more supervision. And it's been a little bit better since we've talked, and I appreciate that. But as mayor, it's my job, and the people expect me to address these problems. So I need as much help as I can get from the county on that. And I want the county to be viewed by all the people of Vista as a partner. And so I appreciate your willingness to partner with us genuinely. Any thoughts you have that you could share on that, I'd be grateful.
Thank you, Mayor, and definitely appreciate all the, feedback. We are certainly committed to partner. Carla was, unfortunately, she was not part. I wish she was part of our program, that we can shelter her and keep her indoors and offer her services. But that was not the case. We did follow up with behavioral health services. Now, of course, there's information there that's protected under certain laws and all of that stuff, but that we're not even, my department is not even privy to it, unfortunately. But those are the laws currently that we're under. But we continue to stay connected and do everything in our power. So for my team, I've committed that we're going to continue to follow up with Carla and continue to follow up with our internal department of behavioral health services to make sure no stone is left unturned there, not just for Carla, but for other folks that might have those issues as well. We've connected with, we've been in contact with, of course, with Jonathan and the team, but we've, met again and, provided as much information as we can. We're sending weekly reports on the Equus Hotel here, so that's transparent as far as we're seeing positive exits out of the hotel into permanent housing. We have not seen, we hope the activity around the hotel is not related to the hotel, but we continue, if there's any complaints, we're certainly open to checking it out every single time, whatever, to address it. So we're fully committed, we're connected, and I echo your sentiment. We want to be good partners, open, transparent, and really help whatever we can connect, folks to the other county departments as well that may be open to those services.
Well, as you know, we maintain a by name list. We're one of the, I don't know how many other jurisdictions, but I think we're one of the only ones that has achieved the real by name list. And we have 292 individuals at least that was the number from last time. We're going to get an update today. But we had 292 individuals in a 90-day time period as of last report. So we know who our homeless population is by name, every single one of them. We'd like, if you're bringing homeless people into our jurisdiction, we'd like to know who they are. We'd like to be able to, we'd like you to, maybe you sign an agreement with our rescue mission partner to share information. They're willing to maintain information in confidence. But when these people, we need to know, is Carla a friend of somebody that was in the program? Is she a relative? How is it that these people, and it was not just Carla, it was Timory and other people that I met. There's a whole group of people hanging out there, and they clearly were having interchange with people that were living in the motel. So are they part of the Equus program or not? We don't know because you haven't given us the names of the people. I mean, we've talked to a few people and we figured out, okay, this one is, that one's not. But if we had a full roster and we could work with you, and we would rather tell you privately when we're having these issues than to review them in public. We'd rather work cooperatively behind closed doors if we are having a problem. But without the information sharing, you leave me no choice as the county leaves me no choice but to assume that you're the cause of the problem and to blame you publicly for the problem, and because you're not giving me the information to know otherwise. So sign the agreement. We got professional people here. They got good hearts. They're going to do what's right. They'll protect the legally protected information. But let's, I don't want to protect Carla's privacy to the point where we're, all of us in this room and all of us in the county establishment basically put her privacy ahead of her well-being. And clearly right now, her well-being is not being served by living out there. And the people that are crawling out of the drainage ditches, their privacy and their well-being is not being served. Thank you very much. I apologize. I really do appreciate you making the effort to be here, and I look forward to working more with you. And I'm sorry to have to be confrontational on this, but please get in agreement with our people to share this information.
Yes, we're happy to meet with your provider. Again, we'll continue to connect with Jonathan and the team and see what we can do. I mean, again, we're here to be partners.
Do you think we could sign an information sharing agreement with our professional outreach team?
We can look at an information sharing agreement. I'd have to, I'm no counsel, so I have to
We're
vet it for.
not going to publish it on the
yeah.
internet. And I'm not asking for it. The deputy mayor's not asking for it. I don't need to see it.
I'm willing to explore
Even,
that option,
But
and
if our professionals could have it so that they could manage cases as people come in and out of, because we're literally talking about walking in and out of that hotel room, once they walk off the property, and if they're not coming back, then they become, our problem to solve, our citizen to help, I don't want to say it pejoratively, but thank you for investigating that. We're going to be following up with you on that.
Sounds good.
Appreciate it.
No problem.
Thank you for that discussion. And in an effort to address some of those concerns, I'm wondering if there is a regulatory mechanism. And so I kind of moved to Beverly and our council to see what authority does the city have to regulate the services that are provided by the county, to require them to have some contact with our outreach to ensure that there is a proper handoff when those services are no longer being provided, as in when someone exits the program. Is that within our capability?
I don't believe there's authority for a specific mandate. However, communication between the agencies would be vital in maybe coming up to with an agreement or between the agencies to facilitate that type of relationship and discussion.
Okay, I appreciate that, just getting kind of a baseline understanding of our regulatory powers here, because we do want to be able to work with the county, but our own jurisdiction is vulnerable to all of the resources that we provide for our residents are limited, right, to those residents. And I have a couple questions about the services and how they're performed, and I'm wondering if there's some further feedback we can provide Is there a strategy for placement into these hotel shelters that ensure that the individual being placed has some link or history or at least proximity to that city or that region?
So yes, thanks for that question, council member. Let me talk about this particular why we came back to this hotel. So we had seen in April, in the springtime, there was a clearing of a large encampment in another city in North, where over probably close to 150 people lived. There was enforcement and clearing of that, and again, that was not under county's jurisdiction. But at that time, we had seen an uptick in our unincorporated communities being neighboring communities here to Vista, a huge uptick of folks. So the reason of coming back to having a Vista location was to have those folks who were in the real close neighboring communities, some on Caltrans, property unincorporated and all of that, were then closer to their home where they're homeless. I mean, their geographical home, I guess, if you will.
So I understand that.
So,
I mean,
yeah.
for logistically placing someone in a shelter situation in proximity to where their encampment was makes sense. But what I'm asking is more of a case management protocol.
Yeah.
If we're providing individualized services, how are you ensuring that those services are, when you are placing those 150 people, that each one is being interviewed and assessed to identify, did they just end up in this encampment in the county? Are they actually from Vista and Oceanside, San Marcos? Would they be better placed at a hotel shelter in San Diego, right? I do have questions and concerns about how case management is being conducted. And along with that, maybe you could answer, this is a big question for me. How far are the case managers from the hotel shelter site? Because I understand you are providing services, right? It's not just dump and go shelter, right? We're all being responsible and making sure that people are continuing to have engagement. Are your case managers located in the city of that shelter, or are they remote? Do they have to come up from county offices? Could you tell me a little bit more about that?
Yeah, I appreciate that. So our vetting into the program begins with our county outreach team. So there's a sheriff's deputy, a social worker, a public assistance specialist, a whole team essentially that engages the individual and begins the assessment. So they will enter them into the homeless management information system. They'll look their history. They will look at their law enforcement, any justice involvement, rule out, any of so we don't accept anyone that has, that's a registered sex offender or has any kind of active warrant or any kind of significant criminal history that would pose a threat to others. So they begin all that vetting before they're ever even accepted into the program. So that generally takes a while, and they get them. They'll help them get their ID. They'll do all of that work ahead of time, and then once they're ready to enter the program, then our contractor will meet with them to complete an intake process. As part of that intake process, they sign client rules and regulations. I've shared that, and we're happy to share that packet with you so you can look at all the detailed information. But essentially, they have to agree to participate in a program. They can't just get in a hotel and be there. They have to be an active participant. So once they're accepted in a hotel, they get a preference of where they want to be placed. As mentioned, like we have hotels across the region, and then some folks are folks here that are from this region, that they might choose this one, or they might say, okay, I have some family, or I'm reconnecting with family down in South, and I want to go to Chula Vista. And so then they can be placed there. Transportation's provided, all of that. Similar if they're exiting the program and not going into permanent housing, but they're exiting for other reasons, we also ensure that we take them back to where they where they want to go or where their preference is to go. Sometimes they go to family, sometimes they go to a treatment, sometimes they just want to go somewhere where they have a connection or friends. So that is all available. Now, people sometimes do just walk out and then we don't know where they are. We lose track of them, and that is never a goal or a focus, but it does happen.
Okay, I appreciate that. So it sounds like the process for placement is a little bit more intentional, where you are, you're not just doing sweeps and encampments and, shuttling people to one shelter, but you are getting individualized assessments
Yes, absolutely.
to determine what is a reasonable proximity and what would place them in Vista. So, and I appreciate that because it is, a regional issue and it's not just someone else's problem. Our city is welcoming to help those in need. However, I am concerned that with those 60% of folks that do not exit successfully, and it doesn't sound like the case management is necessarily a block away and readily accessible, and potentially even continuing after someone exits. If they don't have a link to our outreach team when they enter your program, then our opportunity to connect with them once they exit your program is really difficult. So I would say that it benefits the entire system, right, for there to be a little bit more collaboration. And I appreciate you, Mayor, for bringing this up. I'm looking forward to an opportunity to see if there's an agreement that can come to pass on this, because it's really not about regulating your ability to utilize resources in our community, but it's more about aligning those resources to face the reality, which is not everybody is being successfully housed. And so when people are exiting those shelters, making sure that they are connected to our professional folks and are ready to go for their next steps, because we all know that it can take multiple instances of services in order to have that successful housing link. So I appreciate hearing a little bit more of the timeline and how people are placed. I do think that there is an honest gap about the case management when someone enters your program, and they might be a little bit distant from the case management services, and we have some great outreach services here.
Yeah, we do have, I just want to mention, we do have the program manager who is on site during business hours at the hotel. The case managers do come and meet with the clients. They might meet at the hotel or they might meet somewhere else where like they might take them to an appointment or, different things like that. So that's based on the unique case plan. But they do meet with them weekly. And now we have, connected to Equus. My understanding is Equus has connected with Rescue Mission, but if we're super happy to continue to work. Like, not every city is this, robust when it comes to their services, and I commend you, City of Vista, for that. But so we're always happy to do any kind of communication, or if we do have a person that we might think is going to walk out or go into the city. That's never a goal. Our goal is to connect with our own outreach team and get them to another place if this place is not right for them. So we don't want to put burden on the city ever. But we love to work with your provider, and if there is ever an instance that they're just walking out and end up on a city, we don't want that. We want to be a partner. We have partnered with the Vista outreach team we have a staff actually that comes out with them. So we do have a direct link to the outreach team. And so we are always happy to do more if needed, for sure.
Great. Well, thank you for your time and for this information. Anything
Thank you
further, Mayor?
again. We do appreciate you being here and appreciate the partnership.
Thanks for having me, and we appreciate your partnership. We hope there's other opportunities, and definitely continue talking to Imelda and Jonathan and the whole team. So we're very excited about what could also come from that.
Thank you.
Very good. Thank you so much. All right. Anything further on that item, Jonathan? All right. We'll go ahead and move to the next item regarding our standing committee meeting schedule. And I also just want to acknowledge and recognize that as has been the work of this committee, we have formally formed our Homelessness Commission, which is going to be a resident-based commission, and we will be, sharing some kind of meeting burden with them. So we're going to be collaborating with a resident advisory board moving forward. But we do have some updates to our meeting schedule. So go ahead and take it away, Jonathan.
Thank you, Madam Chair. Yes, indeed. So an update on the Homelessness Commission. The application window closed on August 25th. There were 12 applications received. There will be a special meeting scheduled for September 9th for the City Council to provide interviews for the applicants, for which 7 will be selected for recommendation, and those will be recommended and adopted at a future City Council meeting, likely later in September or early October, for those recommendations for the City Council to approve. On top of that, the next strategic plan workshop is scheduled for October 2nd. The next standing committee meeting would be scheduled 1 week prior to that, so staff are recommending we cancel the September Standing Committee on Homelessness meeting and provide the update during the workshop. Also to note, the standing committee meeting regular schedule would fall in November and December during Civic Center closures, and staff is not recommending that those be rescheduled. And so starting in January 2026, we would start alternating between the standing committee meetings on odd months and the Homelessness Commission meetings during the even months. And we're soliciting city or the committee's feedback on that schedule.
I'm supportive of the schedule updates as we transition to those alternating meeting times. I think in 2026, we'll see, the calendar reflect the standing committee sessions, the Homelessness Commission sessions, and then interjected with those, the workshops with the whole council. And then multiple times throughout the year, we have items on our standard council meeting agenda to address homelessness as well. So I'm supportive of those changes. Mayor, do you have any feedback on that?
Yeah, so what's the date of our workshop meeting?
Thursday, October 2nd.
Okay. And then we would be having, what would we be doing in January?
Standing committee meeting, fourth Thursday. Yep.
Okay. Yeah, I'm okay with that.
Right.
Excellent. Thank you.
It's supported by this committee. Does it need to be approved by the full council?
It should go for recommendation.
Okay.
I think what's best when you collaborate with the commission as well.
Okay.
Go as a package.
Sounds good. Thank you for that item. Now we'll move forward with our final item on general homelessness updates.
Yes, thank you again, Madam Chair. This next general homelessness update will provide updates for the month of July from our strategic plan partners, starting with our HOT team with San Diego Rescue Mission.
Thank you. And before we get started, I just had a question. I have on my calendar here a tour of a property at Business Park Drive to view potential navigation center sites.
That's correct. Yeah,
Is
today at
that
11
still
a.m.
on?
Yes, it is.
Okay.
If the
All right, well,
chair would like to join us, yeah, absolutely.
yeah, if anybody would like to join us on that field trip, you're welcome to. So thank you for being here. Love to hear your updates.
Good morning. Good morning, Mayor, Vice Mayor, Council. Thank you for having us. One thing on behalf of the San Diego Rescue Mission, I'd be happy to start that MOU today with Equus if they were available and wanted to participate in that. I was on a call with the county regarding that, and they threw around the term wraparound services, and it gets thrown around so often, but it's not really happening. And the work that we are doing, we do that, and we would be happy to integrate those people that leave their facilities and get them with the proper care that they need.
Well, if they only have one person on site for Equus, then, I mean, why not? We've got these people are amazing people. Why not let them build a rapport and a relationship and ask how else they can come around these people and support them with job training, with, we have a lot of services. How can we assist if they're here, they're in our community, and literally they're in the neighborhood that I live in, and that I work in. I spend all my time in that neighborhood. I could walk in 7 minutes to where they are. So they are my neighbors now. Let us treat them like they are our neighbors. Let us serve them like they're our neighbors.
Correct, yeah. Quick update, so we are fully staffed now, which is amazing. We got a great team of individuals working together. I've given the team a goal to have 20 people housing ready, meaning dock ready, by October 1st, and we are over halfway there. Meaning, so we've got our housing navigator that's already working with 50 different providers for housing, and then we've got the team of outreach workers that's getting them ready to be housed.
I see a new face here this morning.
Yes.
Have I met you yet?
No, I'm going to introduce her in a moment. This is Kaylin Jason. She will be working with our higher acuity folks. She's our clinician, so I'll let
Welcome.
her say hello.
Good morning, board. Thank you for having me. I just wanted to introduce myself officially. My name is Kaylin Jason. I'll be their associate social worker. I'm very pleased to be on this team. I worked for San Diego Rescue Mission as an advocate for the last 2.5 years. Prior to that, I did do clinical work with a state-run facility. Most of our patients did have schizophrenia or were high acuity, so that's definitely where my heart and passion is at.
Can you put higher acuity into third grade speak for me?
Higher acuity, just chronic users, potentially comorbidity. So you're looking at a lot of generational trauma potentially, which leads to drug abuse as well as severe mental illness. I know that a lot of our clients currently do have comorbidity, so I know that's a little bit harder to treat. I do think, and I agree with you, I love that you're looking towards more provider sharing, because I think that is important. A lot of times I feel like they try to fix the problem just in that moment and de-escalate that situation rather than working together as multiple providers to provide those wraparound services, in my opinion.
Well, thank you and welcome.
Yes, thank you for joining us. We're excited to have more clinical services.
Thank you.
Okay, so
Well, while I'm thinking about it, pardon me, Kenny, Mr. Lung, we had a roster at one point, and I'd like to see that updated as soon
send
as
that out.
possible. Thank you. Of all of our service providers. I'd like to keep that updated. That way the council can have full awareness of the manpower contingent that we've got authorized.
In fact, our providers have direct access to it, so they're updating it live.
Excellent.
So we'll have it over to the committee.
Fantastic. Sorry,
good morning,
Kenny.
Council. I'm Kenneth Tolbert, the data specialist for San Diego Rescue Mission, and I'll be presenting our report for the month of July. Our starting point, as you see in parentheses, we have 125 unduplicated clients. So later I will let you guys know how many interactions that we've had total, but this is the total of clients that we've served in the month of July. Some of these clients are ongoing clients, and some of them are new. Our starting point, as you see here, we have a mixture of emergency shelter, housing, permanent housing, and place not meant for habitation. As you see, the largest number is 108, place not meant for habitation. For anyone wondering what that means, that's basically sleeping in cars, sleeping in tents, sleeping on the streets or in the creeks or under the bridges. What happened with these clients, as you see to the right, is we sent a couple of them to substance use disorder treatment. Some of them we weren't able to place anywhere just because of availability. Resources are very limited. So we have 87 that we met them in places not meant for habitation, and they're still there just because of the lack of resources. A lot of things are winding down.
Kenny, how many of those 87 told us no, they didn't want our help right now?
In what capacity, like when it comes to like shelter itself?
I mean, how many of them said, I'm not interested, if you did have a bed, I'm not interested in going?
Let's see.
I believe that's included on a later slide.
Yeah, that's on the later
very,
slide.
Very good, I'll wait till you get there.
No
Well,
problem.
remember that 87 though, because that's,
12.
okay.
So you'll see that on the later slide, but we like to pivot. So the answer to that is 12.
So all the rest of those 87 were all willing
ready
to
to
go
go.
if we had a place for them.
Yes, sir. As you can see, the next largest bar here is 18, which is Buena Creek Navigation Center, where we placed a lot of our clients. Things have gotten a little tight with La Posada in the changing of North County Lighthouse. So our numbers are a little bit lower than usual, and that's just because of the ongoing changes that you guys may be aware of. So we've been heavily leaning on the BCNC. The next slide shows you the breakdown of the 125, where it's 66 are new to SDRM, meaning these are our first encounters with them.
And 125 is since the inception of the rescue mission service in Vista?
No, this is just for the month of July.
Just for the month of July,
So
okay.
yes, we've came in contact with 125 individual people just for the month of July. As you see, 59 of them are ongoing. So we met these people in previous months, whether it's June, May, April, whatever the case is. Our inception was November, and I'll give you the updates on that
Kenny, the
later.
people that are new to the rescue mission outreach, which is for the 3 people watching at home, that's the City of Vista's outreach in partnership with Rescue Mission. These 66 people that are new to us, what do we know about where these people have come from? How many of them do we think, are we asking people about that? Do we have a sense of how many were homeless in Vista? How many were homeless in other jurisdictions
I
before?
believe that's also on another slide.
Oh, is
Yeah,
it? Good.
there we go.
Okay. All right. I'll be patient.
Okay. To
I'm
pivot.
excited to eat
No
my
problem.
dessert first.
We like challenges here. So as you see in this slide, we have 30 who have been in Vista 1 year or less, meaning a big portion of the new to SDRM are in this category. So these are people that have came from Oceanside and Fallbrook. A lot of the times that we've tracked, we've actually been tracking it. I gave Jonathan an example of one of our charts when it comes to the city breakdowns. I'm not sure if we're going to include it yet until we get a little bit more information. That's hardcore, but we've also been trying to track what cities they're actually coming from, and not just how long they've spent in Vista.
I just want to call this out. Doing the rough math here, it's over, it looks like almost probably 85% have been in the city of Vista for more than 2 years. I get this question all the time, and we do want to know, as an honest city council, are our services attracting people to Vista? Are we making the problem worse in Vista? It's a fair question. A lot of residents ask it. It deserves to be asked. It deserves to be answered. And that's why I appreciate you honestly inquiring this information from people that we're serving and presenting it. I think these numbers are fairly consistent with what I've seen in the last about 7 years. And I think it's very important that we're very honest and forthcoming with this number, because this really, people come to me and I go, 80% of the people that we're serving have been homeless in our city for a long period of time. It's not, it's not this new population. And I think it's important that we address that concern with this fact. So thank you. I just want to highlight how important I think that is.
Yes, sir, no problem. And to answer your question, yes, the services that you guys have rendered are very attractive. There's a lot of people inquiring, especially since the word of the ERF grant being designated to Vista has came out. We've actually, that's what the phone inquiries from ineligible clients comes from.
So you have people that are calling you on the phone asking if you have a bed available for them.
No, they're asking about the about different programs and funds that are available. Specifically the housing. Specifically housing.
So for example, we have the encampment resolution funds, which is geographically, you have to be eligible because you're in a certain region. But we're getting folks who understand the services connected with that grant and are asking to be considered, but we can't consider them.
Yes.
Okay.
You're going to have to remind me, other than our shared housing program, what housing programs do we have?
With the ERF3, it's about $2.5 million in rapid rehousing funds.
Oh, the rapid rehousing funds.
Correct.
Are we going to get a report on that today?
That program has not been implemented yet. We're still developing it together.
Okay, so we
already
haven't
asking
we
about
haven't we haven't approved the outline as a council.
No,
Okay,
it was
but they
discussed.
heard that we're going to give away $2.5 million, and
Yeah.
they're already.
It's a
Already
public
called.
record.
So, what are service providers in other jurisdictions sharing that information, and they're telling people to call us and ask us?
Well, they'll be chasing their tails a little bit because it does have eligibility requirements, which we strictly adhere to.
Yes. So I think they're aware of the whole Hobby Lobby situation where the encampments were cleared up, and just trying to get a foot in the door on the next grant.
Well, this is why I think it's so important that we have our bay name list and we really know these individuals. Because I think if we start with the people who've been chronically homeless in Vista, which would exclude that 30 number, and we focus on solutions for those people who've been a little bit more difficult, but who have been homeless in Vista for quite a while, a number of years. If we can have some impact there, then I think that would be really phenomenal.
Yes, sir. Totally agree.
Because otherwise, if we're handing money to people who've been here for only a few days or a few weeks, that is going to draw people in, and I think we do have to avoid that. We want to serve the people who are here.
Yes, we're our team is trying our best to make sure that we look into who's eligible and who's not. So that's why we started tracking, so we can pretty much keep a track of, just in case there's any type of complaints or anyone wants to know what the criteria is, then we'll be able to explain to them why people are not eligible.
Jonathan, when are you going to start having conversations with us about how we're going to spend that money?
So those funds were originally included with the RFP for San Diego Rescue Missions services. We removed that from the current contract. We are going to recommend it goes back. So why don't we say at a meeting during September, we'll have the program outlined and recommended for adoption.
So the thought is that the rescue mission would have the ability to access those funds and spend them under the guidelines that we create?
That's correct.
Okay.
To finish off this slide, as you
I
can
just want to say, I'm sorry, I'm going to put my thoughts out loud as they're coming to me right now. I love the idea about giving the people who have built a relationship, long-term relationship with the people in our city, giving them the discretion. Somebody's got to be trusted, and this is a lot of trust to put in you guys. Somebody's got to be trusted to say, this person, I think if we give them housing, they're going to succeed, and help them move out of the shelter system into permanent housing.
And
I like
also
that.
say, Mayor, seeing how successful you have been, I'm noticing on the previous slide since November, 245 sheltered with limited resources, right? And the individual case management that you're providing helps to ensure that these funds are going to go to those who are going to be most successful with those available resources.
Yes.
So we'll be leaning on your expertise heavily.
Thank you. We appreciate your trust. As you can see, we have, out of the 125 people that we have came in contact with, 15 are disabled. Our race is pretty much diverse. It's spread across African American, other multicultural, white, American Indian, and Asian, with other multicultural being the leading percentage at 48.
How about veterans? Did we ask that?
Yes, sir. That will be in the next slide. We have 5.
I think I need to highlight this because we just had a presentation on Tuesday night about a home key proposal, and the proposal was for, what was it, like how many units?
30 units.
30 units for veterans, and I'm all about taking care of our veterans, 100%. I love that, but I did have to note that, Exodus was counting 11 veterans. You're counting 5 veterans. So, the number of people who are identifying that they are veterans. And I happen to notice that it seems like the people who are veterans, we're able to get them into VASH housing with pretty good success rate, right? So if they self-identify and give us the power to help them with that. So, I don't know. I'd like to hear on a separate topic, not this morning, but more about their desire to segregate that entire project for veterans. I mean, I think veterans should be included in every housing project, but
I would agree, Mayor. And I'd also say demographic-wise, with the Project Home Key, we want to look at this data that's being collected by our outreach to actually make our services more effective down the line. And, I do see that 15 disability number, and I'm wondering how that's quantified. How are you defining disability?
So physical and mental disabilities. Most of these people that are notated, I would say, as a rough guess, 10 are physical.
And is this self-reporting only? Are there any other assessments? Okay, so
Yes.
my belief is that the majority of people on the street are disabled in some way. They're going through a traumatic disabling event, but they might not self-report that. They might not have the healthcare services that are really diagnosing them properly or assessing them properly. So, I'm all about those empowering conversations to be able to claim those disability rights and acknowledge the actual consequence of their homelessness. So I believe that this number is much bigger. But as far as self-reporting goes, we do respect people's autonomy and self-identification. But that's, another concern is that the disability, it exacerbates the chronicity of the homelessness. And, I'm wondering how we can provide more disability-related services. So.
Thank you. That's a challenge we'll take on.
is it too much effort to break down physical disability, intellectual disability, narcotic addiction disorder, or substance abuse disorder, and then mental illness, so that we can see?
I think
I believe
there's
those
some
counts are on the
value.
by name list portion of the
I
presentation.
think in the by name list, if we're able to identify, and this, people might hit multiple points, right? We're definitely going to see that we're getting specific diagnoses, right? We're understanding what people are really facing. We have a lot of questions, but why don't we continue to go in order? I think that we've completed this
I could just say, I met with
demographic slide.
the San Diego County Medical Society about these issues yesterday, and one of their leaders is a clinician, and made the point that there's individuals out there that are not suffering from substance abuse disorder or mental illness who are unsheltered. And while I believe that to be a very small number of this population, as I think is consistent with what you just said, I think it's important to know what is that number and what's going on with those folks, especially if they're service resistant. It's hard to imagine there's somebody that is choosing to live outside who is mentally well and not suffering from substance abuse or other mental illness. It seems like, to me, not being, and I told the doctor this, I said, I'm not a doctor, but to me, it's kind of prima facie evidence of mental illness if you're choosing not to live in a sheltered environment, if you have the option for shelter.
I totally agree.
It's an important part of the conversation.
Would we be able to go back to complete the demographic slide?
Oh, yes. I just wanted to show you, because by request, you guys said, could we get more of a breakdown? And this is somewhat of a breakdown that we do have
that here?
when it comes to mental health, physical health, legal issues, income. We did this breakdown, which is more so on our high acuity clients. So I think we're at, 34? We're at 32. So this is a breakdown of the 32. So if desired, we can do a breakdown as you request on everyone. And
I was just wondering if you could include it in the demographic slide in the future. If you can, great. If you can't, don't worry about it.
okay, no problem.
I think we have it here. We have the information.
Okay. And on the demographic breakdown, Ms. Chairman, what was the request?
I think we have covered all the information here. We're still seeing predominantly males,
Yes.
and that's something that we have to consider as we're designing future shelter sites.
Okay.
So if we're completed with this slide, let's continue.
Okay. We kind of pretty much touched on most of this slide here.
That's good.
But also, per request, there was a request for the numbers since inception. So we started November, really at the end of November 2024, and we've touched 473 individuals during that time period. Total clients housed, sheltered since November 2024 is 24 housed and 245 sheltered.
Could you go back? Do we know how many of the 407? Now that's unduplicated, right?
Actually, some of those clients have been resheltered. So yes.
So that 473 does include duplicates.
Oh no, 473 is unduplicated.
Okay.
Yes.
And do we know how many of the 473 were unsheltered?
To start with,
Yeah, during any period of time that.
well, all
In other
all
words,
of
I
them-
mean, were there? So this is less than a year period of time. We are trying to get a handle on how many unsheltered people we have. So I mean, is it the truth that 473 people were unsheltered
yes, this is
in
400.
Vista?
Yes.
Okay,
Yes, so this is 473 unduplicated people.
and they're
that
all
we've-
unsheltered.
Yes, all unsheltered
Okay.
at initial contact. Any further questions on this slide?
It's really interesting. I mean, so we contacted 292 in the last 90 days. We're out there working it all the time. Just, I mean, trying to get a genuine handle on how many people are living homeless, unsheltered on the streets of Vista.
Where was that 292?
That was their number from their last report of
Okay.
that
The
was the by name list
292
count
was from
for 90
hold on.
days.
Okay.
Yeah, that was in a 90
And
day
some of those
period,
are
so
and continued clients.
yes. Yeah, so this one would include that 292 in that 90-day period that was asked to be reported on, plus inception. So that's why we're
I mean, it's a mind blowing number. The 473. It's astronomical.
yes,
As a percentage of 100,000 people that live in Vista, that is incredible.
yes, it is. Our location of initial contact, as you can see here, we're starting to track the ERF grant area. So as you see, we have 68 in the orange area, and we have 52 in City of Vista property areas, and we have 5 that we came in contact with on private property. Our contact initiators, we have 3 people that were passed down from the sheriff's department. We have 14 passed down from the community improvement team. 2 people were passed down from the code enforcement team, and 2 people passed down from the Caltrans team. So as we said before, we really welcome partnership. So when we're able to connect with the county, we would love to add them to this slide of people who send us referrals. Here we have the heat map for the city of Vista, and in yellow is the ERF grant area. So as you see, the bulk of our clients that we come in contact with and we service actually are in those areas closer to the freeway and in that grant area. Out of the 125 individuals we serve, we've had 768 interactions. And here's our list of interactions. This is, as you see, we have 19 vital documents. That's in our attempt to get them doc ready, how we were saying earlier, to where they have their driver's license, birth certificates, social security cards. That way they can be ready
I have
to
a
sign lease.
question on this one. I'm seeing street case management. You have a lot of contacts, right? This is exactly what we want to see. You know, one of the things that is not clear is how is the case management different from providing those vital documents, assisting with transportation, linking to shelter, or is the street case management just instances of all of those
So
things
yes,
occurring?
in a way, when we come in contact with a client, we don't just assume and know that they need an ID. It comes from street case management, speaking with them and seeing that their wallet was stolen, and now they no longer have their ID. They no longer have their social security card
Okay.
or anything like
And so
that.
just so I understand the data, so when a
Yes.
street case management is recorded, right, and we have a data point for a street case management,
Yes.
they might have a discussion with the client about their documentation needs. And then when those documents are delivered, would that be considered that vital documents data point?
So the vital document data point is actually when we take them to the physical building.
Okay,
So
thank you.
yes, so if we speak with them on Tuesday and see that they need an ID, and then on Wednesday we take them to the DMV, then we record the vital document on the DMV visit.
And in these street case management sessions, y'all have case notes, right? You guys are documenting, they refuse shelter, they're looking for, recovery services, and that's all, can be
Yes.
corroborated within your case notes. Okay.
Yes.
I appreciate understanding what the distinction is, because I know you guys are doing a lot of work and it takes multiple steps to get to that, positive outcome of you and getting your ID back.
Yes,
Thank you.
it takes a lot. Thank you. Any further questions on this slide?
I mean, you guys are providing amazing services, and you're doing
you.
such a fantastic job of transparency and documenting those for us. So I just want to say thank you. I understand the burden of documenting all of these things, right? It becomes its own separate work that you have to do. But it really helps us to get a bird's eye view of some of the challenges. So I'm just going to point out for us top level issues: shelter, food, and transportation. Those are the big ones on the list. And then somebody to talk to about all these things, right? Which is what our case managers are doing out there. When we have discussions about some of those basic needs, shelter, food, and transportation, I think our committee and our council, we're pretty clear on what the shelter gaps are, right? We're obviously investing heavily in shelter and housing and Vista for all people. But transportation and basic needs like food and clothes, maybe you can speak to the gaps there. When somebody needs transportation, is it easy to get it for them?
Yes, so we do have vehicles, and so every time we transport someone somewhere, so when we pick a person up from their encampment, then that's when we document the transportation, and then we're taking them to the DMV, or we're taking them to different places that they need to go to. So even though that we do have a nice public transportation system, some people that we serve don't always have the funds, or they don't always even feel comfortable getting going with their attire, with their smell, with their items. Thankfully, one of our vans is equipped for wheelchairs, and we've actually often placed people's shopping carts in there in the van, because they may be willing to get an ID, but they're not willing to leave their things. So having the proper transportation to where we can bring their things with us allows them to go in and say yes, and then, leave their encampment for that time to go to the DMV, knowing that their items are safely in the van.
Okay, and to clarify, these transportation services, it includes transportation with your vehicles that are inclusive and equipped with ADA needs. And then would it also include like vouchers and bus passes and those types of things?
We
We could do that. We have
Yes.
not.
Okay.
Can I speak to that first?
Yes.
More questions are going to come up when people begin to be housed because our goal is going to be to get them working, right? And at that point, if they don't have transportation, that's when we'll start to address how can we help support you with self-sufficiency and get you to a point. Maybe it's buying a monthly bus pass for a couple of months while they save up money for some sort of vehicle or to be able to pay for that bus pass themselves.
Part of that helping them navigate, right, and get back up on their feet. And then for food and clothes, you know, I know we face barriers when it comes to shelter beds available. Are we able to help people with their basic food and clothing needs, and how do we go about doing that?
As the rescue mission, we have a huge warehouse. So all I have to do is put an order in, and they will deliver the next Thursday. So we're actually going to put an order in for a larger order. So we've got some things on hand for people.
Fantastic.
Same with food. We've got a large food, but there's also the food bank in Vista that I hear is amazing. I have not been over there yet, but we do have the access to food as well for our clients if needed, especially once they're housed, like filling their fridge and things like that.
Got you. All right, well, thank you. I don't have any further questions on the service interactions.
Here's our executive report. It pretty much goes over basically everything that was covered in the all service interactions. It just gives it a different dive into it and puts everything in percentage perspective. And then it places it in order pretty much how you were talking about the higher needs.
We want to get that shelter percentage up.
Yes.
That's what we want.
We are in great agreement with you on that. It's just been so so tight as of lately. So
Yes, sir.
Shelter ready has not helped that, unfortunately.
Right. It means that people are ready, but we're not.
yeah.
And other cities don't. Other cities like Carlsbad no longer want to take our folks from Vista. They're kind of closing it down to their population, which again creates silos.
Explain to us why Shelter Ready app has done that.
Because they get to pick and right. So if we they only open it up if there's beds available. And from what they've got from the data from Shelter Ready is that they were getting a lot of people from Vista, and we were actually putting quite a few people into La Posada, and now it's closed pretty much every day because they're only servicing Carlsbad from what we hear.
Are they keeping La Posada full with people from Carlsbad?
I would say no. I would say no.
Well, I mean, but are they keeping it full?
I'm sure they're not. Everybody's in the business of keeping their beds full. We don't want people on the streets.
I think the
But
question
you're
is
right
whether or
to call
not
this
they're
out
at
because
capacity,
if
which
there's
I believe they are.
vacancies,
It's more of a matter, I think what Mr. Shack is highlighting is that they're being more selective about who they're taking into that shelter.
Remember that we have a contract through the Alliance for Regional Solutions with Interfaith that we pay them, what is it?
It was 130, that contract has not been renewed.
Oh, it's not been renewed?
It's not been renewed.
All right, we need to look at that again.
we did experience quite a culture shift. And as more cities have pressure to provide services, I believe that cities are becoming more insulated where they're reserving those services for their own residents. But then there's initiatives like the Shelter Ready app, which is aiming to make it more of a regional approach. So I'm going to be following this to see how other cities are meeting the challenge, because we are prepared to engage with residents from all over, right, as long as they're qualified for our programs. If you're in Vista and you're unsheltered, you know, I'm wondering what's the process that Carlsbad services are going through in order to prohibit us, right? What are they looking at, and what's stopping them from allowing
I
us
am
in?
interested too, because a traditional wait list is not the best model because of the time it takes to call down on people and the lost chance that you get. When somebody says, I'm ready for shelter, you have a period in which they're saying yes to a service that Yesterday, they didn't. And if we don't have that available, tomorrow they may not take it.
And so is this, so in this app, you know, created by the district attorney's office, are there preferences that a service provider can, you know, a shelter provider can indicate, right? That they would only accept clients from a particular city?
I don't know how each of them can build it out for themselves because we don't have it as not running a shelter for the mission. But I know that BCNC has just emailed us how many beds they have available, and that works perfect because we can then get the next person in line into a
I
bed.
think I'll put this back over to our staff to see if potentially we can have a representative from the district attorney's office to report on this app and share a little bit more about how it'll impact our services.
I think it can help kind of illustrate how it's facilitated. And we'll use the BCNC as an example since that is our program. We had a hand in designing that portion of Shelter Ready. And I know Mr. Haggard will have some thoughts too, but with the BCNC being as unique as it is, where we have two different cities funding them and we have beds with contingencies on them. So we have a women's only floor. So that bed would be reserved for women only. Okay, then we'll have another floor that is shared for men and women and ADA accessible, or at least more conducive for those who need some assistance with their ADAs. We have top level floors, right? So since we have a 36 to 12 bed ratio between Vista and Encinitas, if one of the beds that's available, it's available to both Vista and Encinitas. If that bed is taken by Vista, the next bed would have to be allocated towards Encinitas. There's no way to create those contingencies for each of those beds. So what we've had to do to work around that is create different shelter profiles that'll show what's available with what restrictions on it. So it's not a completely transparent, enter your client here, you need shelter, and you get connected right away. The way that we're utilizing it is as a way to facilitate referrals. It's not a reservation system, nor is it really a wait list. So when San Diego Rescue Mission has a client that accepts shelter, they'll send in the paperwork. Every morning, Mr. Hager will send out an email to San Diego Rescue Mission to say, we have a bed with these accommodations, right? So this is a male-only bed on a second floor. They'll send that out, and then the San Diego Rescue Mission will find a client that is able to accept that bed. That paperwork will already be on file through Shelter Ready. So we're really only using it to facilitate the paperwork. To use that to try to maybe illustrate what might be happening in Carlsbad, they have the same ability to be a little bit more selective about who receives those notifications if they're not using Shelter Ready at the very shallow level of just facilitating referrals on a first-come, first-served basis, if that makes sense. So there is still a lot of discretion from each of the providers to use that Shelter Ready app
So if
in a
a
way that makes
provider's
sense for
using
them.
the Shelter Ready app, they can add filters, essentially,
Yes.
that would prohibit a Vista resident from accessing that shelter.
May or may not be a filter per se, but more of a way to show beds as available with certain parameters that only certain individuals would see.
And I still would like to hear more from the district attorney's office if we could invite them. Thank you.
Okay, moving to the next slide. This is the City of Vista Homeless Report dashboard. And this monthly report provides a snapshot of homelessness using data collected from the by name list. Our goal is to provide actionable insight that drives coordinated care and intervention for the city's most vulnerable residents. As you can see, we started off at the beginning of the month with 326 people. Our inflow, which is comparable to the previous slide, is 66 new clients. These are people who are newly experiencing homelessness, new to the area, return to homelessness, or return to active. Our outflow is 36, 4 going into permanent housing, 4 unknown or inactive. We just lost contact with those people after 90 days, and then 28 people placed in shelter. At the end of the month, leaving us with 356 clients. This slide here, it shows our pretty much the 356 For July, the previous month was 326, and the 3-month average of our list is 332. When it comes to high utilizers and chronic homeless, we have 32 people on our priority list, which is the same number as last month, June. And our 3-month average for our chronic and high utilizer list is 31.
So I have one comment on this, and this is just how I'm visualizing the information. You know, I see that we have, by the end of the month, we have 356 folks, right, from the previous slide. And then we're seeing, you know, how that changes throughout the month. And then you go into a little bit more detail about, you know, what are some of the barriers and high users and more specificity. But there's generally several stages that someone's going to go through as they go through the program, right? There's going to be like an intake stage, and there's going to be like, you know, setting up basic needs, and then there's going to be like, you know, successful sheltering. There's going to be, you know, monitoring them for permanent or long-term housing. And so, you know, as I'm visualizing the information, this is not necessarily a request, but if you happen to have this, you know, available next time for us, that would be cool. But just being able to see, you know, how many people are in that intake stage, right? How many people are in that sheltering stage and those transition stages? And because I know that you don't keep people in intake for long, right? You guys are moving people through the stages. And so maybe you can even just share some narrative and speak to that about how you guys are moving people through the process.
Okay, so pretty much like a road from the beginning to their end, basically, in a way.
Yeah, I mean, we see their entry and their exit. And then if you had some narrative, yeah, we'd love to hear from you. Come on to the mic. Yeah.
So what we've done is we started phases for them. So once we do the intake, and then phase 1 is getting their ID card, because that's, you know, what we need first. And then it's phase 2, and we actually put when we started it and when we completion.
You guys are already doing it.
So phase 2 is, the next phase would be getting their social security card. And then we put what day we did it and what day it was completed. And then the third phase is getting their ID card, their social security card, and what day we did it and what day we received it. And then the fourth phase would be if they have any income, like what the income was, and that should be 30 days before we actually put them into their place. Because that has to be current. So that's kind of how we're navigating this. And it also is in Eponics. So if you were to look in that, we have an agreement, you can actually see those phases in the case management notes.
Fantastic. I'll take a look at that. Thank you so much for that explanation.
Really quickly, with the high utilizers, higher acuity folks, what we'll be doing, because Kay will be doing clinical assessments with them, and she'll have to take clinical notes, but if anything is ever requested, we would be able to provide like clinical summaries that don't give as much information, but I know that there have been certain people that you have asked for information on, so we could do that in a discreet way, just to let you know.
Thank you.
Here's our primary barrier breakdown. And again, this number is for the 32 high utilizers. So we have evictions, incomes, mental health, physical health, substance use, support system. Again, these are all self-reported. So as you said previously, that, you know, the mental health number should be a lot higher, and we totally agree. It's just we're not in position to, I guess, place a label on someone, so we're only going by what they're comfortable with letting us know. And here, we're almost at the end of the road, is our success story. We have a client who has been homeless for 11 years. They became homeless because health issues connected to cancer led to the loss of employment and housing. The barriers that they had is an ongoing fight with cancer, Their tipping point was the tipping point is we've witnessed a powerful turning point in our client's journey from homelessness and battles with cancer to hope and stability. Since the start of our outreach services in Vista, he's connected with the BCNC, North County Lighthouse, and Safe Parking in Vista. And with support from city and county resources and programs, will soon move into his own apartment with permanent supportive housing. The lessons learned was never stop looking for solutions. The more questions you ask, the more your clients participate in resolving their own issues. Hope is a powerful motivator, and God will open the correct door at the correct time. The agencies involved in this gentleman's road to housing is SDRM, the BCNC, the North County Lighthouse, and Safe Parking. And where they went it's a PSH match in Carlsbad.
Wow, thank you for that testimony and that story. I'm very, very moved by this, and I think there are a lot of lessons learned. I want to have faith that we can intervene and help people, and we clearly are. But it is absolutely devastating to see how our healthcare system has completely abandoned people and resulted in disability and an inability to actually get well. And seeing this person fight with cancer, lose their employment, lose their housing, it is just an absolute sin of our nation. And I believe healthcare is a human right, and that if someone's going through cancer, that this should never have to happen to them. But we've been able to intervene, and seeing the agencies listed here, that's a very powerful reminder of why our strategic plan to address homelessness must include these robust services, and ultimately that permanent supportive housing piece. Wow, very motivating for us to continue to bring on those services. So thank you, and thank you for advocating for them and helping them.
I want to say thank you too. Obviously, anybody who is chronically homeless for 11 years, during some period of that, they must have lost hope. And clearly you were able to help them find that hope again and show them the path. I would imagine there's a lot of feeling of, I don't know if it's helplessness or, just not knowing what to do to solve the problem. So I think it's incredible that we were able to come together as a community to help that person end their homelessness. Hopefully they will remain housed next year and the year after and for the rest of their life. It really is, like you said, Deputy Mayor, it's emotionally, it's incomprehensible that people suffer for that length of time. I think there are solutions out there, and it's just a lack of connecting people with them. I think there's solutions for every single person. I know that we're short of shelter beds and we're short of housing units, but we've seen over and over and over again, have we not, that where there's a will and where there's hope from our clients, there is a way to get them off the street. They have to fight for it. And unfortunately, those who aren't well enough to fight for it tends to be the ones that are hardest to help, right? That's the real shame in all this. I really believe if we did a better job helping those people that weren't able to advocate for themselves or didn't have the mental strength and wellness to advocate for themselves, I think we could end homelessness for a lot more people a lot faster.
Yes, sir. Yeah, I'm so grateful for not only our team, which is growing, but so many different partners that we have in the community that help us blur the lines in the sand between companies. Because as you see, I don't think we have one success story that we were able to create on our own without the help of the different organizations here in Vista that are helping the homeless community. So I'm very grateful. I'm grateful that our team is growing. And as you said, hopefully he's housed for, a year, 2 years, and more years to come. Thankfully, he has permanent supportive housing, so that's permanent. And we have housing stabilizers now on our team who are going to make multiple visits throughout the week, depending on their circumstances, to make sure that they're following the rules to where they're not being evicted because of cleanliness or other issues or anything like that. We're going to actually make sure that they have a place and they're able to keep their place.
Very good.
Thank you.
Yes,
Great
sir.
work. Great report.
Thank you.
Yes, sir. Thank you. Thank you for your time.
Okay, next up is an update from Program Director Pete Haggard of Retread of the Buena Creek Navigation Center.
Hello.
Good morning. Good morning, Mayor, Deputy Mayor, John, good to see you. I get the pleasure to present today because Nanette is out of town, so here we go.
Very good.
This is for July. So as you can see, we've had 19 intakes in the month of July. 100% of those intakes are from the San Diego Rescue Mission. You're going to see that as a trend going forward. If you look in our year to date or our 6 month to date, it may look like we were getting referrals from PATH and all these other places, but as of right now with this partnership, you're going to see next to 100% coming from them. With that being said, only 57% came from places not meant for human habitation. That's realistically almost, the number is much higher, but I think that maybe the thing with Equus, a lot of them were coming from hotels, motels, so maybe they were experiencing homelessness immediately before, but then they went to the hotel before getting to us. So maybe that's the reason for that.
Peter, are we asking people when we do our intake interview?
Yeah,
if they
so
were,
that's that's the data from what we asked them at their interview. So where were you the night before today? And so we had a couple that came straight from hotels, but it was because they were waiting for that shelter bed to get open, et cetera. And I think the Rescue Mission or Equus and
do
may
we
have been
ask
able to
them?
help them with that.
Do we ask them what service providers they were working with
Yeah,
in the last year?
yeah.
That'd be good to keep
Oh, with
track.
the last year. Yeah, we could look into
Because
that.
that way we could kind of figure out what different programs people were in, and would be good to know.
Yeah, it would be. We have a little bit of that, but through Clarity, the HMIS, but that's regarding, we always have, when we have a new intake, we put them into HMIS, and then we hope that previous case managers and things like that did notes, and some of them do, and it's very helpful. So the sharing of information would be awesome. As you can see, most of the intakes, you can see that we had a large majority of, probably 5 of them were only homeless for 1 to 3 months, but the majority are that 2 to 5 years, 5 to 10 years, or more than even 10 years. So you can see that. Services that we provide at the BCNC, VI SPDATs, cash assistance, housing assistance, employment assistance, cell phones, health insurance, social security cards, DMV, family reunification, financial assistance, vehicle assistance, et cetera. Referrals provided, that's kind of services that we don't provide in-house, but we refer out. Resources provided, bus passes, Chromebooks, bicycle use. Chromebooks, I like to mention that. We have a big thing of Chromebooks, and it kind of, I think, it replaces them having to go to a library and sit in the library and do all of that. Like, they're able to use the Chromebooks to look for work and all that kind of stuff. We provide classes, recreational meetings, mental health meetings, faith meetings, anger management meetings, NA and AA support. We also had on-site partners with the Bellis Academy. They come and do haircuts, and sometimes they'll come and do nails for the ladies and things like that. We have a lady that comes and brings cell phones in a partnership with the YMCA. Exits, so like we said, we had 19 intakes. We had 15 exits during the month of July. 67% of those is what we believe to be a positive exit. That means they moved into their own housing unit, or they moved in with family and friends on a temporary basis, or rehab, or a long-term skilled nursing facility, et cetera. But we also had, 33% that move back into a place not meant for human habitation. Not the greatest numbers that you would like, but for whatever reason, for the exits that in the month of July, the average stay was much longer than normal. And our average stay for positive exit was 100. Average stay before permanent housing was 114 days. That's dependent upon those 15 clients alone. So that's what that, you can see at the fifth slide that that's not to our normal percentage, but so this is, we started to look into income. So
I think if we're getting people housed permanently,
yeah, you can see
you know,
that
if however long it takes, but you know, I mean, that's the end goal. If we're getting people permanently housed, that's what matters.
That's really kind of been my motto in general, is that when we have somebody, we do, I want them to be housed. You know what I mean? I want them to be in the right exit strategy.
We don't want
for
them coming back to
I don't
us
want
homeless
it
again.
to look good on paper, but they're just recidivizing and stuff like that.
That is
So,
the number one key metric here is
Yeah.
permanently housed when they leave us. So
Yeah.
always, you're right to put that ahead of length of stay.
Yes.
I just want to get the people we know we can't help.
Yeah, and that's something that I've been pressing on my
That's
case
tough.
managers
That's
and my
tough. I know.
team, et cetera. As you can see, why that number even was really high is we had somebody that kind of deceived us, I guess, and they were able to stay. They even had a signed lease agreement, and then last minute, before they were supposed to move in, they called us and said, "Oh, well, I'm at La Posada now." They somehow got a referral there. Wow. So those kind of come, and that happens sometimes, but I'm trying to get my team, myself, to be really discerning. Hey, is this person really legit? Is this person telling the truth, et cetera? But sometimes even our team.
You don't have a
gets
crystal
through the
ball.
crack.
You're not going to know for everybody.
Yeah, not going to know for everyone. But
As long as you're doing the hard thing of, look, we know this person isn't going to, they don't want it.
Yeah.
Let's make a place for somebody who does. But if somebody's not honest with you, or you think they're on the, I mean, you're doing the best you can.
Yes, thank you.
I
sir.
recognize that.
Thank you so much. So this is for the City of Vista in July of 2025. This is, so as you can say, with those numbers, this is also the numbers of the clients that we served in July from the City of Vista. You can see on there, I can pull it up on mine so I can actually read it. 52% when they come to us, they have no income at all. And yet we're still able to somehow get around 70%, 72% positive exits. I think that's, I applause my team for that. But you can also see that that it's hard. You know, they come to us, they have a limited time to be with us, and many of them have no income at all, and it's really hard to get somebody housed when they have no income. But during that process, we're trying to get them, you know, if they cannot work, then we're trying to do the process of getting them Social Security income if they qualify, or disability, et cetera. It takes time. But also we've been really, really encouraging people and having job readiness kind of class. We have a resume building thing, and Nanette actually helps build people resumes right there on the spot. We've been trying to build relationships with staffing agencies, et cetera. And so, as you can see, 9 of our individuals in July had employment. Another 15 were on Social Security income or Social Security disability. Those with Social Security income, their average amongst all of them is about $1,300 a month. And the ones with an earned income is around $2,100. So from March, okay, so this is from opening. We have served over 272 clients in the City of Vista. Total Vista clients that were exited from start to the beginning of July is 236 clients have been exited. Of those, we believe 61% have been positive. That's what we see, what I've said before. They go into permanent housing, a lease with something with a lease, or what we believe is moved in with family or friends that when we spoke to the family or friends said that they can come in permanently. So of that 236 exits, we had 69 move into new housing units, 20 move into family, friends on a permanent basis, and then another 34 moved into transitional or temporary housing facilities or programs. That would be like rehabs, or maybe for a few of them, skilled nursing facilities. Another 20 moved into family or friends, but I really press it on my case managers to try to understand, does that seem like it's a temporary exit or a permanent thing? So when they say, like a family member says, hey, they can come in for, we'll see how it goes, or, 2 months, et cetera, we put it under temporary just in case they do end up recidivizing. 4 people went into jail or prison. Another 84 went back into places not meant for human habitation. Our average length of stay since opening and operating is 65 days, so that's a little bit more. I know those July numbers seemed a little higher, but normally from opening till now, the average length of stay is around 65 for all the people, 80 for those going to positive exits, and 75 to permanent exits. Oh.
Okay, next up will be Safe Parking Director
Thank
Jesse
you guys so
Mendez.
much.
Thank you, Pete.
Yeah, I got a
Anything you need
baby
from
on the
us?
way, so I'm going to take about 1 month off in October. But I look forward
Congratulations.
to seeing you guys, and you guys are always welcome at the BCNC. We love it when you guys show up. So thank you so much.
We'll see you soon. Good luck.
Thank you, John.
Next up is Jesse Mendez, Safe Parking Director of the JFS, for an update on safe parking.
Hello, how you doing?
Hi, good morning.
Forgive me, this is my first time coming. Our former director no longer with JFS, and so it's going to be my first time presenting on Vista's outcomes and numbers. One thing I would like to start off with is I would really, as I can see by the multiple agencies, that's
Talk right into that microphone.
Oh, sorry.
That's all right. And there's a little button on the dais you can push or raise that whole thing up for you a little bit.
yeah. Oh, I see what you're talking. Thank you.
There you go. You gotta push it again.
I don't know what's going on.
There you go.
Sorry about that.
It's all right. Now push
I
it
don't know
again.
what's going on. Okay.
You gotta push it. Push it once to start it, and push it once to stop it.
You're
My
a tall
apologies.
That's
guy.
good, though.
I think
That's
it's real
perfect for
chilly
you.
now.
Yeah.
My apologies. I just want to say that it is very clear that Vista is well invested into, focusing on resolutions as far as the homeless situation that you guys have going on here in Vista. I primarily focused on the other safe parking sites that Jewish Family Service operates down in for the city of San Diego. But one thing I was talking to my boss, I just want to be sure it was okay to state this out loud. But Vista is the most invested city out of all the cities that we work with as far as funding providers for safe parking. They require the least investment out of Jewish Family Service, and that's funding will definitely reflects on positive outcomes no matter how you look at it. Yeah. So thank you for that. So what we're looking at is, for the month of July of 2025, we could see that there was 31 total individuals enrolled into safe parking at the time, not newly enrolled, but totally served for that time frame. 25 households. Individuals served, which I believe are intakes completed in July, were 10 households, 15 individuals. It's broke down, one of the pie charts is broke down by age, and we can see that there was 2 children, how's that look? Yeah, 2 children, and then under 18 adults, 7 adults between the ages of 18 and 54, and then 5 older adults above the age of 55. As far as the households go, which zip code they identified as being their most recent zip code before becoming homeless, 4 of the 10 identified being just from the North County area, 4 directly from Vista themselves, and 2 from outside of the area of Vista or North County. We've had 5 total exits for the month of July. 3 of them are identified as unknown. 1 was positive into a family reunification, and 1 was a negative exit.
What happened with was it one household with children, or were there multiple households with children?
I don't have that breakdown to know if it's one household that has the 2 children or if it's one.
Do we know what the status is of the households with children?
Like if they're still enrolled in the program, I'm unfortunately, yeah, I'm not. I do know, I'm aware of that that is your stance, that you do not like to see.
Well, I'd like to send the bat signal up and do everything that we have to do
100%.
to get those kids out of living in cars. I mean, that should
Absolutely,
be
sir.
everything else we're doing here should be dropped.
Absolutely.
And figure out how to get the kids into an indoor environment where they have a bed to sleep in. Children shouldn't live in the backseat of a car,
Yes, sir.
and have to try and go to school. That's just totally the fact that we're not calling Child Protective Services.
Mm-hmm.
I have I know a lot of people would say that that's mean and cruel,
Mm-hmm.
and I don't want to divide any families, but if we have the money to get those people out of their car and get those children out of a car, and the parent says no, they should lose their children to Child Protective Services.
Mm-hmm.
If they say yes, I'll get my children indoors where they can lay in a bed at night and have a shower and proper sanitation, then I think we should work with them. But that is just, the mistreatment of children to be made to sleep in a vehicle night after night is completely morally objectionable to me.
As a father of 2 young children, I would do everything in my power. If I ever ended up having to choose to live in my vehicle, I would be the first person to accept any resources that were made to me to not have that situation. So
We need to get a report on what's going on with those 2 young children.
100%. As when I was looking over this, I was a little prepared. Like I said, this is going to be my first presentation with Vista, and also it's less than a month that I'm actually
With this
taking
$2.5
over.
million of rapid rehousing, put all of it into housing these kids. I'm serious.
Yeah.
I don't care about housing anybody as much as I care about getting children into a permanent, safe housing environment. I want John Conley called. I want to be called. I want the deputy mayor called. I want a phone call to all of us. I want to sit down. I want everybody in this room to come together and have a case conference about how we are going to collectively solve the problem of getting those kids out of living in an automobile. We certainly have the resources. We're spending $30 million now as a city on all these services. There's got to be a better solution.
Thank you, Mayor, for the kind of value of the data that we're able to collect here, and maybe this is for Jonathan. It would be great to follow the process of those in our services with children. Where do they ultimately seek permanent housing? And really getting more data on that, because I'm imagining some of it will be family reunification. Some of it may, and perhaps we don't know this, Mayor, that there may be other authorities that are already engaged with that family. But also we do have Operation Hope, right? And so we have never enough resources for family homelessness, never enough. But as far as like the data presented today, I definitely want to know the status of those individuals. But and if that's the family that had the negative exit, right, that would be even more concerning.
I could tell you that wasn't, but
Okay, that's-
but I
I'm
couldn't.
imagining
When
so.
in my mind, I couldn't tell you that that's not the positive exit either.
Okay.
You know, and so like on my next presentation, I will be very much more prepared with that extra data that's not on this dashboard to be able to
Completely understand it. And we have so many different services,
Yeah.
right, where we are engaging with families who are experiencing homelessness. So being able to understand what are the unique outcomes for families experiencing homelessness.
Absolutely.
When you come back, I want you to have with you the person who's the on-site, because you're not on-site here, right?
No, sir, I'm not on.
I want the on-site person to present with you. It's okay that you're
Absolutely.
here, but I don't want the on-site person getting cut out. I want to see who
No,
that person
absolutely,
is.
sir. Like,
I want to be
yeah.
able to touch them.
Absolutely.
I want to know who they. I like these organizations that it's the same people again and again and again.
Absolutely.
You need to have a culture where you're keeping your people happy and they stay. And because I've noticed the organizations with the turnover, they struggle.
Right.
We've got great organizations here. I was compliment all of you because the people are the same people year in and year out. It really matters. So
Yeah,
take
we
care
have
of your
the
people.
same supervisor and the same case manager that implemented the Vista Safe Parking still
I know
employed.
I've met them.
Elizabeth couldn't be here today.
I know I've met them, but I haven't seen enough of our on-site person to lock in their identity in my brain.
Yeah.
Which, because I know generally GFS has presented some more executive or senior level people, but I want to see the people that are on. I
Absolutely.
want to see the people that are working directly with the clients.
Yeah, absolutely.
I want to
sir.
hear what's in their heart, and I want
Absolutely.
them to
Next
mess.
month you'll have
I
that.
want them to mess up and say the things you told them not to say in the open meeting. All right.
Never that, sir. So to get back on that, like I said, next time I will be sure to have extra data as especially as it relates to families and you know, just any kind of status of what their plan is, or you know, what I can tell you is that we also operate a family site and down within the city of, bless you, sir, within the city of San Diego, that gets larger families out of their vehicles and into a trailer that's connected to running water, sewage, solar, and we get those families into those trailers while we're transitioning them into housing. It's outside of Vista. It's one of our other most successful safe parking sites, and it is directly correlated to that. Families are coming in there. We do receive a lot more. A lot of people are very much interested in the outcome of families, especially as it relates to funding and donors as well. So it's 100%. I firmly believe that a family should be a quick and fast transition out of homelessness and directly into housing. But as you also mentioned, sir, it would directly result in the willingness of the parents. You know, but yes,
Any mentally healthy parent is desperate
100%.
for a housing option for their children.
And out of the positive exit, the average length of stay, so it's just one positive exit, and this measures the length of stay of that positive exit, which was 33 days. As I mentioned before, I wish I could tell you it was that family. I don't know, but I can't tell you that it's not at this moment. Yeah, the average occupancy of Vista, so I'm just kind of reading off what it has here. And the average occupancy rate for attendance for the month of July was 68%, and the average nightly occupancy was 17%. I do know right now that that Vista is almost at capacity as far as their enrollments go. We do prioritize enrollments into the Vista Safe Parking site for individuals that identify as that they're homeless in Vista versus from being outside of Vista. We do have people that are interested in coming to Vista, but they're either screened out into other safe parking sites that we have where in the areas where they are homeless at versus bringing them up to the Vista location. One thing I did want to identify that's not on this, I had some numbers ran just for my own personal knowledge. As of since inception, Vista has had 160 exits from its safe parking program, and 53% of those were positive exits, either into permanent housing or into a family reunification setting. Out of those, 30 out of the 160 exits, 37.5% of those were directly into their own permanent housing. So that's amazing numbers, in my opinion, and it shows that the commitment of Vista and the services that are provided in this area.
All right, well, thank you for these updates. I appreciate being able to get more information on family-related services because our safe parking program is really, at this time, the only sheltering service that the city of Vista offers that can accommodate families. I know we're hoping to be able to accommodate families in some of our other sites in the future. And also, never to be discouraged about positive exits, right? I think that when we compare percentages amongst our different programs, it's really hard to get folks into that permanent housing, right? So as we're touting that 37%, for our research and for our advancement of our strategic plan to address homelessness, I'd love to see, what is similar amongst our providers, right? That allows us to get people into those permanent units because as we are dealing, with contractors, right, and not providing these services in-house, we're really relying on you and your expertise and your methodologies to get us to that place where people are permanently housed. And there are best practices and there are excellent standards across the board. But I would really like to, maybe have some more deep dives with our staff about how we can develop our contracts and really focus on the details of what is a successful programming and case management to get higher and higher positive exit outcomes. Because I think we can learn from all of our contractors and identify, what are the strengths that actually results in those higher numbers of permanent supportive housing placement. So that's my reflection on this. I don't have any other questions, but thank you for, welcome, and thank you for being here today to share these updates.
What was out of the 242 individuals served since August of 23, what's the total number of those in percentage that had a positive exit?
So I ran the households. So there's 172 total households that were served, and of those total 172 households served, 160 we've had exited since inception of the Vista safe parking, and so of those it was about 84 were successfully exited into like when we talk about family reunification.
84 out of 160?
Yes.
So a little bit more than 50%?
53%.
53%. Okay. And those people are permanently housed now?
They were transitioned to a more stable living situation. So what we identify like family reunification and 37 and a half of those of the 160, which is about like 60, were permanently housed into their own permanent housing.
And I'm noticing a difference now in hearing some of the providers today. And I'm not saying that there's a right way or a wrong way. It's more about creating cohesion within our strategic plan. Permanent supportive housing is its own specific service, right?
Yeah, I'm sorry. PSH, permanent supportive housing, is when I'm saying permanent housing, I'm not speaking of permanent supportive housing. I'm speaking of somebody that's in their own rental, whether they're receiving ongoing subsidies or not. It's like we're just talking about permanent housing.
And
so someone that's
your number for that is 37%.
37.5%.
But then 53% is like a positive exit into some other type of housing.
More stable living, yes. And so out of their vehicle, and that could also reflect into a shelter as well.
That could be a shelter as well. And so when we're hearing from our shelter providers, from our outreach team, from our safe parking provider, it might be nice for our city to start to define these terms, right?
Absolutely.
How does the city of Vista define a positive exit? And if you're leaving the safe parking program, yes, I would say that going to a shelter is a positive exit from sleeping in your car. So there will be some differences, but it would be nice for our city to be able to promote that 50% of all of the programs that we offer result in a positive exit. But we have yet to quite define what that positive exit is, all the different type of housing options, right? No lease, family reunification, and home share, different models like that. So that might be something that in the future we start to define, and then we can, as we're updating our contracts, be able to have those kind of clear metrics and goals. And it's not to, that feedback is also recognizing the success, but seeing that we have all these different contractors and we are kind of using different terms to describe the same thing.
Absolutely. So, like, if for a provider that's working with just doing outreach, I believe the hot team that you had up here, they do a lot of outreach for street homeless and stuff like that. So, a positive metric for them would be getting somebody off the street that's sleeping in their vehicle or on the side of a road or in an encampment into safe parking or into a shelter versus like safe parking wouldn't be able to consider getting into another safe parking, transitioning safe parking to safe parking. So I think that being able to identify different measures and I always encourage the funders 100%. You have the power as funders to dictate what you want to consider a positive measure and have anyone that's applying for your funding or working for your funding to adhere to those.
Absolutely.
One more question. Can you remind me what our current annual funding commitment is for the safe parking program?
About 550.
550. And what's the total cost?
I want to believe that the total cost for like this would just be a rough somewhere between 575 and 6.
Okay, so
JFS does have a small investment into the safe parking program here operated on the Vista site.
Over 2 years, JFS's contributions will be about 15,000.
50,000.
So primarily funded by the city.
Yeah, as I mentioned when I started, like Vista, as opposed to other funders, you guys really have set the bar on. You can always tell funders. And I'm going to use the term investment versus and more of a in heart and meaning versus financial, based on the financial means that they're providing to a resolution or to an intervention. Because just in my experience, I've been working in homeless services for over 16 years, and sometimes people have or funders have $1 million expectations for a $250,000 budget, and so we really appreciate working with Vista.
what was the average? Do we know the average duration of stay for all people served?
Not in this slide, sir. I believe that we maybe on the next we'll be going over, I believe, the fiscal year, I believe in October, and I think it'll be in that presentation.
Okay.
But right now, no, I do not have those.
One of the things I'd like to be able to compare is basically the cost, the daily cost. Because I'd like to know. Let's see. Yeah, I'd like to be able to figure out what it costs us to provide this service every day for the people that we're providing it to, and be able to compare that with how much more would we have to spend to put them indoors.
Right.
I know these are people that in many cases don't want to get out of their car, but I'm consistently wanting to get people out of their cars, rather they parked the car and slept in a bed.
Absolutely.
If we can do it. So I'd like to be able to keep that benchmark of the cost in front of our minds as we receive these reports. It's important for all of our service providers. Everybody needs to be constantly telling us what their cost per day to shelter somebody is. We need to keep that as a ready comparison, so we can kind of see who's doing it the most efficiently. I appreciate it.
Thank you.
Thank you.
Up next is an update on Shared Housing Innovation Pilot Program with Brenda Viveros from Townspeople.
And we're going to still try to make an 11 o'clock tour at the potential Navigation Center site. So I appreciate you joining us, and we'll try our best to stay in order and take in everything you have to share with us.
You want to help her with the podium?
Yes, absolutely. Good morning, everyone.
We'll bring that down for you.
Oh, thank you. Yeah. Thank you. Okay, let's see. Okay, to start off, we are recapping navigation numbers for shared housing. So in July, we had 7 new enrollments in the navigation phase and a total of 26 folks in the navigation phase. And in July, we exited 11 people, so that's 9 adults and 2 children moved into housing in the month of July. Stabilization for July. As you can see, that coincides with navigation. So folks were in the navigation phase. We had 11 folks move into stabilization. And then we have a total of 40 enrollments, 40 people that are housed, and that's comprised of 37 adults and 3 children that have been housed since the start of the program. And this is an overview of navigation for the entire year, starting in July of 2024 through July of 2025. So again, this is in the navigation phase. We started off a little slowly as we didn't have the staff to support the program right away as we were getting started. So we really started seeing our clients coming in October. And then you can just see as we picked up steam, progressively uptick in our enrollments. So from July of last year through July of this year, we served 59 adults, 8 children, and that's a total of 50 households, heads of households, and then total served is 67. And 83% moved into housing, which takes us to our stabilization for the entire year.
They moved into the shared housing program.
Yes, into shared housing. Yes, so they initially start with that housing location search phase, and then once they're housed, they get connected with their stabilization specialist that meets with them weekly, monthly, working on a individualized housing support plan.
How many housing units do we have now that are master leased?
There's 9 master lease units. So here in July, the total is 41 adults, 5 children. Households are 34, and then total served are 46. And then we had 80% of folks stayed housed with shared housing, and 100% were positive exits. So we did have
you had to exit 20% of the people from the program?
Excuse me?
Did you have to exit 20% of the people from the program?
I don't know. Yes. So we did. We had 9 closures. 3 folks essentially.
What's a closure?
So an exit or a closure from stabilization. So
let's call them exits if we can.
Sure. So 3 exited from stabilization.
And what were they positive exits or negative exits? Do we know? Are we tracking that?
Yes, they were all positive exits.
Oh, that's good.
So these 3 essentially kind of graduated from the program. They became self-sufficient. We didn't really need to check in on them anymore. They became responsible, good tenants. They didn't really need our help.
So that means that they became the lessee of their apartment unit. Is that correct? Or they leased an apartment on their own without any assistance?
Well, this together is just, well, you know what? I guess all of our master lease clients, they're still in stabilization. So those folks have not been exited yet.
But what about the 20% that you had to exit?
Yes.
So not, to be clear, not all of our housing placements include a master lease.
Correct.
So there might be some who exit from the supportive services of the program and are able to, have been linked to housing. And so I'm very pleased to know that the exits that occurred were, we still have people in the program. People are still working in the program.
Oh, absolutely. Yes.
But then the exits that occurred were because they succeeded in the program.
Exactly.
So we have, let me get this straight. We have 9 master leased units.
Yes.
How many housing units total are part of this shared housing program?
I can show you on a slide that's coming up.
Okay.
Just so I don't backtrack.
I want to, again, I like to eat my dessert first. So I want to know what our cost is, because I'm really proud of this program to talk about the dollar efficiency of housing people in terms of our cost. These are the costs. These are the actual costs right here.
Yes, this is a snapshot. So this is giving you an average. So the housing types on the left column, those are the units where clients have resided in the past year. Those are the types of housing. Then there's the average cost per unit. And then if you break it down, right, because we're shared housing, when you split that cost among two incomes, that's the average costs per person.
Do we know what the actual cost per adult participant is?
I can get that for you.
I think it's important. Can we write that down, please, Jonathan? Can you make a note of that? I want to be able to report to the public what the actual rent amount being paid by the adult participants. That's the amount that they are contributing for their own housing. And then the dessert I want to eat is I want to know how much did we pay? What was our total cost? Because we have an expense here too. But I think it's pretty low, and I'm excited if I'm right.
Well, this is the rental assistance utilization. So again, this is the flex fund. And again, this is more of an average because it's really tedious when you break it down by participant in a household, and then they have
No,
their
I think the
housemate.
average is fine.
So this is typically what it looks like. So
This
out
is
of the
per
19
request.
households,
How many months have we been operating?
it's been, well, we've got an extension to finish through the end of the year.
First client was housed in
For
October.
1 year, but a large portion of that, we were not fully staffed.
Yeah, so
on
the
the previous
first, so the
sites.
contract began July 1st. First client was housed in October 24.
How many? I'd like to know how many housing unit months. So one housing unit times 1 month is a housing unit month. I want to know what our cost is, what the city's cost, what the city's expenditure is per housing unit month. Let's stop, and I want to do that math right now. So do we know how many households we've served for how many months? How many housing unit months? Does that make sense?
Yeah, how many total months of assistance?
Yeah, how many months of,
Well, here,
maybe how many adults times how many months? Do we know that number? That's probably the number I really need. How many adults times how many months? So if you served 10 adults for 1 month, that would be 10 adult months. If you served, 10 adults for 10 months,
I see that there's 19 households that received some sort of subsidy assistance. Because the benefit of the townspeople program is, of course, you have rental assistance, but then also just the linkages and connections to shared housing is also a benefit. But we're providing a benefit right now to 19 households. And what was your information you're seeking, Mayor? How is
I'm
that
trying to-
averaged out in terms of
I'm
cost?
I'm trying to figure out what it costs us to pay for this program
I understand. Yep.
per adult per month.
Yep. Just like we do with the shelter bed cost per night.
That's exactly right. What is, we have
Well,
that
this is how many
information?
clients we'll have. We'll have to go back and take a look how many months of assistance each of these clients have. We could do that easily. I don't think we have that today, but we can follow up with
Well,
that.
it's not a very difficult mathematical equation.
I just
How
don't know
much
that we-
money have we spent in the first year?
Again, I don't have that in front of me, but if we take the average amount of rental assistance per month, we can probably multiply that by how many adults we have. We'd still be missing how many months of assistance each client received. Some of these clients might be funding their own leases on their own, having stabilized. We can follow up with that. I don't know that we can determine that this morning, but we can certainly find it.
I would like if we could follow up with that
Sure thing.
information.
I mean, to me, the key to this program is the self-sufficiency aspect. It's the only thing that makes this exciting. That and the fact that this is a where could people go once they leave the shelter. This is a transitional or permanent housing opportunity. But the fact that we're able to add a little bit of government money and make it possible for people to be semi-self-sufficient and get them to self-sufficiency, this is the thing that I personally am most interested in seeing in your reports. Because this is, I would like to give you more money and expand what you're doing, but I need to know that it's as efficient as I think and hope that it is. If it is, this could be one of the greatest success stories that we tell in Vista. We had this same discussion a couple of months ago, Jonathan. I'm going to become very upset at our next meeting if we don't have these numbers, because I feel like this might be the second time that I've asked for them. So I really need these data.
There is information that I would like as well. So if we could go back to the slide where we were, the 19 households. Okay, we see 53 applications, and then we see the average of the request that's issued. But how is that expected to increase the longer people are in the program? That said, how long are we offering assistance?
Typically, it's a year. And
So is this average a monthly average that we're covering $1,700 of the rent per month? Or-
yes,
Okay. Per year. So we need to fix that. So it says 5.8 average requests per year per household. Shouldn't it be per month? If this 1719 is per month?
oh, I'm sorry, that's right, well, no, that is, yeah, it gets
So
very
we're gonna
granular when you're breaking it down by housemate, then one housemate. Yeah, it just,
So we're looking for information of the average subsidy per month per household. And from that, we're going to be able to, make a lot of determinations as to the value of the program. So this might need a little bit of cleanup,
okay,
but I do appreciate seeing our initial numbers at 1,719. But I'm imagining that as the year goes on and our averages become more accurate, that number is going to change. So I think I want information about how many months, we're providing for a year, but what really is that year average? Maybe we're anticipating it, but we don't know that yet because we haven't had a full year of active program participants. Question, Mayor?
I'm not super happy with the management administration of this. So when we see this again, if you don't have the command of the numbers, then I'm going to recommend publicly that we find a different operator. So I want to get a handle. I mean, we were real slow startup, but I could deal with that because anybody might have had that problem. But I want you to get with Nanette or Kenny, and I want you to ask for some help with the numbers. You should have the data in front of you. We should be able to do this, Matt. It's a very simple algebraic equation. We should have these data in front of us. And if we don't, if we're not armed with the data, then it's a really big problem.
So I wouldn't be making that recommendation. I'm willing to work with you, but I do think that there needs to be useful information provided. This is not the most useful information for us right now. We want to hear about the successes, but the way that some of this is charted out, I think we're really looking for simple information as to the cost per month per household, and that we have that all transparently in front of us. I was very excited to bring on townspeople because I think that programmatically you're very effective. But this, as an oversight committee, we need to make sure that our review of the data is very stringent. And so going forward, we're going to want to have a clear understanding of what are some of the outcomes and what are the costs. We can go ahead and move forward to.
I'm breaking this down right now. 91,143, which is obviously we spent that money. I don't know what other money did we spend in the last 12 months. What was our total expenditure in 12 months?
I'll have to take a look at that. I don't have it in front of me.
So I think it's safe to say that this presentation, we're going to want to do a cleanup, and next time we're going to have a little bit more useful information broken down for the committee.
Yeah, I think we only have about 2 minutes before we need to leave to go see this property. Jonathan, Mr. Conley, I want to see a summary document, a chart of how much money we have put into each program. I want the public and the council to be able to easily digest what our investment is into each of these programs for the last 12 months, or maybe for whatever period of time you deem reasonable. And I want to start to add some columns as I want to this chart. How many adults were served times how many months? How many adult months for, this is a long-term program, so I'm going to measure it in months. but I want to know what my cost is per month to serve every adult. And I want to, if right now, I know I've got the math wrong because I don't have all the data, but I'm looking at about $400 per adult per month. But I know my math is wrong here. I know I'm missing inputs that I need to make that correct. But it would be so amazing if we could get down to, $100 or less per month to house an adult. Then we could just make this so big, and we could go to the state and say, we are housing people. And if I can open up housing through shared housing, then I can open up the beds in our shelters. We could free up the beds in all of our shelters countywide. We could do amazing things with this. I am more excited. That's why I'm being harder on you than anybody else, because I'm more excited about what you're doing than all the rest of it, because this program represents the potential to open up beds in the shelters everywhere. This could be a game changer.
And to try to put a bow on this conversation, I think the next couple pieces of information you have for us are a little bit more on demographics, income, and we appreciate that information as well. We want to know programmatically what is happening, but as this is essentially a pilot within its first year. We want to see what some of the financial burdens to the city looks like. But I do want to highlight one real big positive, and that is that this program meets the needs of those working people, where the highest percentage of people in the program, 43%, are making over $2,000 a month, right? And these are low-income individuals, but still working people, most likely, who are benefiting from a subsidy so that they can sustain their housing. Beyond learning a little bit more about the demographics and understanding the success stories, I definitely do want to see more clear information about the average cost per subsidy, because this can be replicated and we can find out what's the most effective way for us to build the program and grow it out so that it can serve more people, because I think that there are more people who would be served by this program, and I agree with the mayor on that.
Yeah, the sad reality is the city doesn't have the money to do this at scale. I mean, you got 473 people that the rescue mission is. So we need a lot of units here. So we can't blow this up at scale with our money if it isn't a very low cost. But I think if we could, this is it's tremendous what we could do here. Who are we missing that hasn't given a report yet? Because it's time for us to go to this.
We have an
other
update from
appointment we have.
BHAP C2. There have been no awards, so if the committee would like, we can just save that presentation for the workshop.
Yeah, I think so.
There have been no awards, so we're looking forward to
Correct,
hearing
yeah.
updates then. Thank you, everyone, for joining us today. And
I'll also offer, if I may, the additional metrics requested today for this program. Would it be sufficient to have that for the next workshop, or would you like that ahead of time?
I'd like it as soon as possible.
Sure.
please.
I mean, just so everybody understands, I mean, this is how we solve the housing problem. It isn't with government subsidized housing. It's with really helping people to afford market rate housing, giving them the support that they need. That's what this program represents. Market rate housing shared so that we literally divide the cost of it in half or less. This is how we make housing affordable. This is how we get people housed. The government cannot pay for enough housing units for everybody that needs a place to live. We just don't have the money. But this is something where we can multiply the fishes and the loaves. We can take a small amount of government money and assist people in obtaining market rate housing, assist them in the roommate relationship, assist them in mediation. If they have 1 month where they miss, this is where we should be, where we have somebody who's committed to paying the rent in an apartment that they are the lessee of, and they miss a month. This is, and they're going to get, this is where we should be using this VHAP money instead of handing it out indiscriminately $10,000 at a time. This would be a phenomenally better use of that money. Getting people who we know have been chronically unhoused into this housing and then case managing them to make sure that they remain permanently housed. This is such an important thing.
All right, thank you. I'll Any further comments?
thank you so
We are
much.
adjourned, and we'll see you soon.